Think back to one of your favorite doctors and think why that doctor was so special to you. It was the personal connection, wasn't it? That's important with any healthcare professional. And there are several qualities that a dental practice and a dentist should have when providing treatments to their patients. I asked Dr. Swearingen and Dr. Bartolome to tell me just what kind of things their patients should consider before selecting a dentist or a dental practice. Doctor, how would you suggest we go about finding a general dentist?
Well, most patients start by asking their family and friends for a good general dentist. And while that's not a bad place to start, it's not the best place to start. You should consider other things. Most patients evaluate their dentist by their likability, whether they like the staff, the dentist, how much it costs, and so on. But they have no idea what real quality dentistry is. So it's better then to take it a step further and do some homework. You can check on where the dentist has gone to dental school. Work experience, how long they've been doing it, is very important. You should check with the Better Business Bureau. Any action against the dentist there should be considered. The Board of Dental Examiners also, if there's any actions against the dentist there, you want to know that. Once all that's been taken care of and approved, then another thing you can do is check and see if the dentist is a member of the Academy of General Dentistry. It's a very good dental organization, very well respected, and most quality dentists belong to that organization.
So doctor, I've done my due diligence, I've found my dentist. What's the next step?
The next step would be to call the office, and basically you're interviewing the staff. You want to find out by the way they handle you whether or not they make you feel comfortable, whether or not they're concerned about your needs. See if they're warm and caring and concerned. If you have good vibes about the office, then I go ahead and schedule the initial exam.
Doctor, what should I expect from my dentist when I come in for that initial exam?
Well, during initial exam, you want to make sure that the dentist does a full set of x-rays, an FMX. Also, they want to check your temporomandibular joint for any clicking or popping or any discomfort in the muscles of the face. We want to make sure that the dentist does a oral examination for oral cancer. Look at any soft tissue, look at the gum tissue. From there, we want to look at the bite in function, also look at the occlusion, see if there's any wear on the teeth or any fractures, things like that, or reasons why the teeth would be in that condition. Also, we want to look at any areas of decay, compare those areas of decay to the x-rays themselves, and then come up with a treatment plan that's going to work for the doctor and the patient.
So doctor, what should I expect to pay for good general dentistry?
You know, the price ranges, but for good general dentistry, you want to make sure that you pair quality with the price. So usually good quality dentistry is going to cost more than poor quality dentistry. Sometimes dentists can compromise what they're doing or the kind of care that they provide with the patient at a lower cost. They're probably using a lower cost materials, a substandard laboratory. They may be fitting in a lot of procedures in a shorter amount of time, and that decreases the type of quality and focus and attention that's needed to do the job done right. So I wouldn't really use price as a factor. I think the bigger question is, how can I afford good dentistry or quality dentistry? The good news is there's a lot of different payment options, payment plans, care credit, all these types of things that are available so that patients can get the quality dentistry that they deserve.